Welcome to the annual McGovern-Tracy Awards program of the Department of Family Medicine and Community Health. We greatly appreciate that you are joining us for this recorded event. Regrettably, we're not able to gather for a reception, dinner, and presentation ceremony this year at the Monona Terrace, where we've held this event in the past. But with great thanks to Matt Fleming, Stacy Lansing, and Sue McGuire, who are wonderful DFMCH staff members, we're able to gather by video. This event honors the accomplishments of a group of amazing students, residents, and faculty. It also honors the memories of two remarkable women, Isabelle McGovern-Kerr and Michelle Tracy. It is my privilege to once again tell you about them. Born in Milwaukee in 1910, Isabelle McGovern-Kerr graduated from the UW-Madison and had an accomplished career in food service, including 13 years as the New York Herald Tribune's food editor and test kitchen director. She volunteered her time as well, serving for over 30 years as the uncompensated food editor of a Braille magazine, Keeping in Touch, where she provided recipes and advice. Much to the surprise of our department, following her death in 1998, word came that she had left a generous bequest to the UW Department of Family Medicine to support scholarships in honor and memory of the many members of her pioneer Wisconsin family who graduated from the UW and who were some of our state's earliest family doctors. It was the department's decision to designate these scholarships for students and residents who exemplify values of community service and leadership. The impetus for honoring service is also the legacy of another inspiring woman, Michelle Tracy. A medical student who entered the UW School of Medicine in 1997, Michelle volunteered to be a key member of a medical school group that went to Malawi in July 1999 to provide care to individuals impacted by HIV/AIDS. Her tragic death while involved in that activity was a profound loss for our educational community, and of course, an incalculable loss for her family. Michelle Tracy is well remembered by all who knew her for her kindness, her dedication, her intelligence, and for having devoted her life to the promotion of human dignity. You will hear more about her later in this program. Following her death, we in the Department of Family Medicine and Community Health have been committed to honoring Michelle's example and her memory by co-naming this annual award for her, and therefore designating those who have followed in her path as McGovern-Tracy Scholars. We greatly appreciate the warm relationship we have had over the past 2 decades with Michelle's family, her mother Candy, father Dan, brother Brandon, his wife Dara, and their daughter Layla, as well as their generous support for this award. I do want to particularly acknowledge the wisdom and vision of John Fry, our former chair, for shaping and shepherding this unique event. It was John who conceived of the McGovern-Tracy Scholar Awards and who set the tone for the depth of meaning they have encompassed since 2001. This is the 20th anniversary of these prestigious awards, an important landmark. And we've also been fortunate to be able to additionally honor other students for their impressive accomplishments, thanks to the caring of other donors. As we come together for this celebration of connection to community in this year of challenge and change, it is fitting for us to pause and contemplate activism. James Baldwin, the great writer and activist, in his books, essays, and speeches, described the experience of being Black and of being gay in America like no other. Baldwin once said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." Baldwin was, quite frankly, not an optimist about our ability to take on difficult issues. He said, "People can cry much easier than they can change." But he also said, "Those who say it can't be done are usually interrupted by those who are doing it, because he saw so many examples of committed change makers. We celebrate those doers in this event. To set the tone, we have the good fortune to have a wonderful keynote speaker. It is my great privilege to introduce my longtime friend and colleague, Dr. Susan Scotilack. A graduate of the University of Michigan Medical School, she completed her family medicine residency and her MPH at the University of North Carolina before joining the faculty of our University of Wisconsin Department of Family Medicine in 1986. In fact, as our careers in the department began, we were practice partners at the Northeast Family Medical Center. Susan had a particular affinity for medical student education, directing our department's pre-doctoral program, as we called it then, and ultimately being recognized for her abilities as an educational innovator by the leadership of the UW Medical School, leading to her becoming Senior Associate Dean for Academic Affairs. Her talents and insights as an educator ultimately gained national recognition. I will just note that she is the recipient of numerous honors and awards. And in 2009, she became the Group Vice President for Medical Education at the American Medical Association, where, among many other extraordinary accomplishments, she has led the AMA's Accelerating Change in Medical Education initiative, promoting innovation to align physician training in medical school, residency, and beyond with the rapidly evolving landscape of our healthcare system and our country. Throughout her career, Susan Scotillack has been an activist. She has understood at a depth that few do that the structure of medical education shapes the lifelong careers of physicians. So, promoting the connections of learners to communities can transform how medicine is practiced for decades into the future to better serve the needs of our nation. I'm reminded of the words of Children's Defense Fund founder Marian Wright Edelman, who said, "Service is the rent we pay for being. It is the very purpose of life, and not something you just do in your spare time." I can attest that Susan lives by those words. That is why she was asked to be the keynote speaker at the very first McGovern-Tracy event 20 years ago. And it was also because she had known Michelle Tracy as an accomplished and inspiring medical student. So it is with great respect, appreciation, and affection that I introduce our keynote speaker, Dr. Susan Scotillack.
Greetings, McGovern-Tracy scholars, Department of Family Medicine and Community Health faculty, staff, students and residents, and guests. It's an honor and a privilege to speak to you today on this occasion that marks the 20th anniversary of the establishment of the McGovern-Tracy Scholars. I'd like to speak to you today on 20 years of inspiration and imprinting. Do you ever wonder why we established these awards? And I posit to you that two important factors are inspiration and imprinting. So let's start with inspiration. Certainly the two namesakes of the McGovern-Tracy Scholars were amazing and inspiring individuals. Isabelle McGovern-Kerr was the daughter of John McGovern, who served as a general physician in southeast Wisconsin in the middle of the 20th century and provided dedicated service to patients for decades. And Michelle Tracy, a UW student poised to graduate from medical school with the class of 2002, whose life was tragically cut short in 1999 in an accident while participating in an educational program in Malawi, Africa. Michelle was indeed an inspiring 24-year-old who had volunteered in many ways even before entering medical school, and was an active leader in the medic clinics, our student-run free clinics around the county. Michelle was among 14 students who organized a trip to study the healthcare system in Malawi and also to help develop services for children orphaned from AIDS, including delivering books and materials to a number of locations, such as the Malawi Children's Village, which is a home for children who had been orphaned by AIDS. Now, it was July 4th in the morning of 1999 when I received a call from AES International, a Mr. Patrick DeRose. I was serving as the Senior Associate Dean for Academic Affairs at the time at UW and was the emergency contact for international travel. He called to say that our group of students who had been on their way home were in a tragic accident when their van was hit by a train. Our two faculty members, Craig and Crystal Jurdy, were injured, as were a number of students. And unfortunately, one of our students, Michelle Tracy, lost her life, as did the bus driver. It fell to me to notify Michelle's parents as well as to make arrangements for safely moving our students from the local hospital to a trauma center in Johannesburg, Africa, and helping to get them home. We had the address for Michelle's parents, but no one answered the phone. So we enlisted the help of the then UW Dean of Students, Mary Rouse, who went door to door in their neighborhood and found a neighbor who indicated that over the 4th of July, they would be spending time in their vacation home in Upper Wisconsin without a phone. When I talked to Candy and Don Tracy that day, I had a glimpse into why Michelle was so inspiring. I remember talking to Candy, and despite the tragic death, she said they were glad that Michelle had made the trip to Malawi to fulfill her dream of helping children with AIDS. And within a week, they had established a memorial fund to honor her memory. What an inspiring family. You can think of many who serve to inspire you to achieve your own aspirations. I call out Gene Farley, who is unfailing in his vision for family medicine, and my colleague at Northeast Clinic, Jeff Patterson, who is committed to providing high-quality care to transgendered persons before anyone else in the state would do so. And to Beth Potter, also committed to providing and improving care for minoritized and underserved populations. And while those that have passed before are easy to come to mind, know that you all inspire each of us, you scholars, you faculty, you residents, through the day-to-day work that you do. But let me turn now to the second factor that I called out in this talk, the factor of imprinting. This new batch of McGovern-Tracy scholars are being recognized for their early accomplishments that follow the values that have inspired us. And those early experiences will imprint on them a passion for the kinds of accomplishments that we only can wish for them in their future careers. My own work in leading change in medical education was heavily influenced by the imprinting of my teachers and colleagues in family medicine. I learned about the importance of community and context in care, of the social determinants of health, of understanding systems and leading change. And it's been rewarding to see the adoption of these concepts into medical schools over the last decade. Through a grant program established by our work at the AMA in 2013, we have been successful in adding a third pillar to the core content of medical education, that of health system science. Health system science includes population health, systems-based care, change management, communications, patient safety, quality improvement, social determinants of health as understood in the context of care, and even structural racism as it influences health inequalities. Taken together, health system science becomes the force by which we provide care delivery and are able to apply the basic and clinical sciences, which were the former two pillars of the outmoded Flexnerian model. It's only through adding health system science and all the appropriate content related to that we will fully be able to achieve the triple aim of better care, lower cost, improved patient satisfaction. It was through my own imprinting in the values of family medicine that I realized that health system science was the missing core content in medical education, and worked hard with others across the country to define the content in health system science, develop a textbook and the core curriculum. And I am proud to say that now, after 8 years of work, we have distributed $30 million in grants to schools and residencies to implement this new curriculum, and more than 2/3 of medical schools across the country are now teaching health system science. I hope that Isabelle McGovern-Kerr and Michelle Tracy would be happy to see these new directions in medical education. You know, I am inspired by this group of McGovern-Tracy scholars, and I hope their imprinting of experiences for which they are being honored reinforces their leadership, using the principles of system science that they affect change in our healthcare system so that we can realize that most profound and elusive goal of healthcare and health for all.
Thank you, Susan, for those inspiring words. Carrie Chapman Catt, who was born in Ripon, Wisconsin, and grew up in Iowa, was a leader of the women's movement over 100 years ago, with a focus on the basic human right of women to vote, which finally came to fruition in 1920. She followed that by founding the League of Women Voters, with a goal of assuring that the right to vote would be supported for everyone. Asked about advocacy, Carrie Chapman Catt said, "To the wrongs that need resistance, to the right that needs assistance, to the future in the distance, give yourselves." It is that future that we think of as we announce our student awards. We have a wonderful group of presenters for these awards. This trio of lead faculty of our DFMCH Office of Medical Student Education especially know our students based on their connections in serving as advisors, teachers, and program leaders. Krista Pittner-Smith, who directs the P1PP program that places beginning medical students with family physicians and other primary care clinicians for their initial clinical experience, will present the Compassion in Action Awards, with special thanks to the Pastor Family Foundation for support of these honors. Mark Beamsley, the outstanding director of our Office of Medical Student Education and the leader of the Chronic and Preventive Care clinical course during Phase 2, will tell you about the Bruhlman Awards, funded through a generous bequest from the estate of Dr. Lester Bruhlman. And Jake Bryan, who is the faculty advisor for our award-winning Family Medicine Interest Group. This year, our amazing FMIG received its 7th Program of Excellence Award in the past 8 years from the American Academy of Family Physicians. Jake will present the Founders, Corbett's, and Vogel Awards, with thanks to the Wisconsin Academy of Family Physicians, as well as the Corbett's and Vogel families for their support. And now, here's Krista, Mark, and Jake.
Hello, I'm Krista Pittner-Smith with the Department of Family Medicine and Community Health, and it's my pleasure to announce the winners of the Compassion in Action Award for 2021. This award is given to first-year students who demonstrate exceptional desire to provide good work in an underserved community. This year's award winners are Eric Sanson and Megan Zander. The Compassion in Action Community Health Leadership Award is given to third or fourth year students planning to pursue a career in family medicine with a special emphasis on care for underserved populations. It's my pleasure to announce the 2021 award winners, Yanzi Yang and Angela Olvera. The Compassion in Action International Health Leadership Award is given to a third or fourth year student who has demonstrated exceptional service in improving the health care of a disadvantaged or underserved community internationally. The 2021 award winner is David Marshall.
It's my pleasure and privilege to announce the winners of the Dr. Lester Brillman Awards for 2021. The first of these awards is the Dr. Lester Brillman Scholarship Award. This is given to excellent fourth-year medical students who are planning to enter a career in family medicine. This year's outstanding student recipients are Courtney Bork, David Glopke, and Gerardo Rodriguez. Next is the Lester Brillman Advocacy and Leadership Award. This award is given to a highly qualified fourth-year medical student who is planning a career in family medicine and who has excellent leadership experience. The outstanding student this year is Jane Salutes. Lastly, it's my sincere privilege to announce the winner of the Dr. Lester Brillman Mentorship in Family Medicine Award. This award goes to a preceptor who's an excellent teacher and who supports family medicine as a career and student interest in family medicine. This year's outstanding faculty winner is Dr. Stephen Holthouse.
It is my pleasure to announce the winner of the Founders Award presented by the Wisconsin Academy of Family Physicians to Nivi Nair. It is my pleasure to announce the winners of the Robert F. and Irma K. Corbett's Endowed Scholarship to a third and fourth year students interested in family medicine training. This award goes to both Benjamin Cannonberg and Rupi Shah. It's my privilege to announce the Vogel Foundation Award recipient. This award goes to a fourth year student pursuing family medicine training with an emphasis on serving the underserved. This award goes to Kahua Yang.
We host these awards so that we won't forget people who had an impact on our work, our lives, and our communities. The activist Afeni Shakur, who 50 years ago was an advocate for racial justice, once said, "I guarantee that the seed you plant in love, no matter how small, will grow into a mighty tree of refuge." We all want a future for ourselves, and we must now care enough to create, nurture, and secure a future for our children. It is my distinct honor to present our next award, the Janash Memorial Award for Excellence in Community Radiography that is grounded in love and caring. 16 years ago, the Janash Memorial Award was created as a tribute to the memory of Janash, a dedicated professional radiology technician and beloved member of the Northeast Family Medical Center staff for nearly 25 years, who died in 2004. The intent of the donor, Jan's partner Gary Morgan, was that this award come from the Department of Family Medicine and Community Health to highlight the importance and satisfaction that a career like Jan's in community radiography entails. In doing so, this award also honors the contributions to our missions that are made every day by the many, many outstanding staff of our programs and our clinics who join together to offer extraordinary care to our patients and our communities. Jan combined her professional excellence with a commitment to advocacy for women, incorporating her own life experience with breast cancer into promoting regular access to mammography in all of her interactions with patients and colleagues in hopes of increasing early detection. The Janash Memorial Award is presented annually by the DFMCH to a student graduating from the University of Wisconsin Hospitals and Clinics School of Radiologic Technology, who displays the technical skills, ability to communicate with patients, and cooperative team spirit that was the essence of Jan's work and that characterizes the contributions of so many staff at our clinics. In many paths in medicine, high technology attracts much of the focus during the training years. Yet, those of us gathered for this event know that there is so much to be offered and gained doing generalist work in communities. The annual recipient of the Janash Memorial Award is chosen for his or her caring, empathetic approach to people, as well as his or her appreciation of the value of community radiography services. He or she is recognized each year by the DFMCH at the McGovern-Tracy event and ultimately receives the award, including a stipend, at the graduation ceremony of the UWHC School of Radiologic Technology. Plaques posted at the school and at the Northeast Family Medical Center list the names of honorees. I'm delighted that this year's recipient of the Janash Memorial Award is Shantae Bell. Shantae understands that as a radiographer, she provides an essential component of quality patient-centered care. In an essay, she wrote, "Exceptional patient care to me means to be adaptable, empathetic, timely, and to have great interpersonal skill." Her work as a CNA prepared her to provide what she describes as gentle patient care. Keeping this in mind, as a student over the past 2 years, she's been engaged in learning the technical aspects of, as she put it, the vast opportunity that radiologic technology has to offer. Shantae also has a strong feeling about, again in her words, how vital minority representation is, as she describes her future in radiologic technology, both to make a difference for patients and to increase diversity in the profession. Her faculty note that she displays an enormous amount of skill and enthusiasm for radiologic technology, and they laud her dedication, strong practical skills, and excellent communication. Shantae Bell clearly exemplifies the values that my friend Jan Ash epitomized in her career. In a few months, at the graduation ceremony of the School of Radiologic Technology, Shantae will be given a memento of this award that reads as follows: the Jan Ash Memorial Award 2021, presented to Shantae Bell for gentle care, for comforting smiles, for compassionate attention, for unwavering commitment, for professional excellence. That is truly the legacy of Jan Ash. It is fitting that her memory will continue to inspire the talent and humanism of healthcare professionals for years to come. Hosea Williams was not as well known as his close friend and partner in advocacy, Dr. Martin Luther King, but he was an important leader of organizing, of marches, and of elections for decades. And it was Williams who said, "We build the path as we can, rock by rock." In reviewing the accomplishments of those who have been named McGovern-Tracy scholars over the past 20 years, I can say that they are indeed rocks, who throughout their subsequent careers have continued to build paths that lead to a more equitable future. They are an absolutely extraordinary group. Again, our thanks to the Tracy family for their extreme generosity, which along with McGovern funds contributes to appreciating this year's recipients. To present the McGovern-Tracy Scholars Awards, I am pleased to turn to Dr. John Hawkins. A valued physician at our Sun Prairie Clinic for many years, John is also a service chief who provides crucial leadership for a group of our practice sites, and he is a family medicine leader on the Meriter Hospital medical staff. In addition, John has led our DFMCH Awards Committee for several years as he has been committed to sustaining the memory of his cherished medical school friend, Michelle Tracy. So, to present these awards, John Hawkins.
I want to introduce James Earsink as one of the winners of the McGovern-Tracy Award. I want to speak from his personal statement. As a volunteer street medicine physician for the Madison Street Initiative, I've been able to go beyond clinic walls at least once per month to provide direct care to individuals living on Madison State Street who would not otherwise access our medical system. Together, may we each step out of our comfort zones in whether it is in thought, advocacy, policy, or direct service, go to the people who need us the most. Well deserved, and congratulations, James. Next, I want to introduce Allie Wolf. Allie's work in modular diversity training called Microlearnings, and as co-founder of the Anti-Racism Education Advocacy Group, or AREA, will prepare her well for her future. To speak from Allie's personal statement, these programs have been a meaningful part of my residency experience, what I describe as heart projects. They reflect avenues in which the medical professional can be involved in their communities and partner with organizations that have paved the way. Congratulations, Allie. Introducing Simon Yadgar. As Simon speaks about his work for healthcare reform, I again want to quote his personal statement. I found that as I become more vocal about healthcare reform, that my classmates became more vocal about healthcare reform and about building a culture that values the health of our patients and community above our own success. My empowerment became the empowerment of those around me. Feeling I've played a part in this change, small though it may be, gives me hope that I can use my voice to advocate for the voiceless throughout my medical career. Congratulations, Simon. Well deserved.
Barbara Jordan, the former Congresswoman and inspirational civil rights leader, had it right when she said, "Think what a better world it would be if we all, the whole world, had cookies and milk about 3 o'clock every afternoon and then lay down on our blankets for a nap." I agree with Ms. Jordan. But alas, the world is not so simple. So we need you, and you, and you, and you, and you, and so many more to come together to repair the world so that we can all walk in justice and peace. On behalf of everyone in the DFMCH, I want to offer heartfelt congratulations and appreciation to each of our award recipients and their families and friends. Our recipients are the brilliant beacons of what can be. Thank you for sharing your light and your warmth. To all who have viewed this event, I hope that you reach out to them to extend your congratulations. And so we close with the simple and elegant words of the Mahatma Gandhi, a person who exemplified justice and peace, who counseled us all to be the change you wish to see in the world. Thank you, and take care.